I actually bring Mr. King, the client, in, it's important that I actually sanitize the entire bed. As per COVID protocol. Sanitize the sink area as well too. So basically we do a lot of sanitization around. Then I will then wash my hands. I will also take off my watch and my rings because you don't want to be scratching or hurting the client. So now I will take the sanitization bottle out. I will then bring the paper, so when Mr. King comes on, you know, he will be lying on paper. Great. Hello, good evening, Mr. King.
Good evening.
How are you doing?
Excellent.
Awesome, great. I will get you to complete this COVID screening form, and then after you complete it, I will then take your temperature, and then I will get you to complete a health history questionnaire. The pens are all sanitized, but you can sanitize your hands for me.
Okay.
Thank you. Hands, forehead, which one?
Okay.
Awesome, 33.1. You to complete the health history questionnaire,
Okay.
and then, you know, I'll take you into the treatment area,
All right.
and then sort of explain to you what I will be doing. So now you come in here for foot reflexology. So what we'll do, we'll start with the feet, right? So you'll pull your pants right up to the knee, right over to the knee. You'll take off the socks and shoes.
Okay.
You will sit in the middle of the bed,
Okay.
right? So what I would want you to do, you'll go under the sheets, all right? So you'll go under the sheet and the blanket, lie on your back, and then I will come back in.
Okay.
Okay?
All right.
Do you have any questions for me right now?
Which way is my head?
The head is that way,
Okay.
and the feet is
Okay.
this way.
All right.
Okay, you have any questions to me right now?
No.
Okay. Do you like it deep or do you like it superficial?
Oh, deep is better. Probably.
Deep is good?
Yeah.
Okay. Okay, awesome. So I'll be back in about 2 minutes.
All right.
Okay, thank you. Okay, I'm going to be doing some finger walking. So I'm just checking for the pressure points, your reflexes. I'm looking at the spine. This is the spinal area here. We're just doing some finger rubbing or finger swiping. Your shoulder down here. I can feel. Any pain in the shoulder?
Not right now. No.
Okay. So basically your feet is divided in 4 sections. I meant to walk with the paper, but I have it outside. So I'll show it to you before you go. So this is the pelvic area, the pelvic sciatic area. Here is the abdomen, Then we have the chest area, which is the thoracic area, which is around the heart area. And then we have the head area. Okay, so I'll show you the diagram in terms that I printed out so that you can have a look and see which zones, because our feet is actually the blueprint, you know, of our body. So the bottom, the plantar, which is the bottom of your feet, actually represents the organs in your body.
Okay.
I'm just doing some cross walking right around the thoracic area, which is your chest, your heart, your lungs. Then we're gonna go down now to the stomach. And here is a bit of the thymus. So I'm gonna get you to do some diaphragmatic breathing. And as you do the diaphragmatic breathing, at a count of 3, I will insert. So you're gonna hold, you're gonna in, and then you're gonna hold it until when I tell you to release. When you release, you're gonna go, okay? 3, 2, 1. Push. Great. One more time. I'll get you to do me another one. Sometimes you switch hands because of the thumb. So 3, 2, 1. In. Release. How was that?
Good.
Did you feel anything?
Well, the pressure, I didn't, you know. Yeah, it feels good so far.
You're a bit tight to the Achilles tendon. So I'm just gonna do some pressure. This down here is I'm at the knee area. So I'm gonna wiggle it out. So I'm gonna do some circular techniques. This is the sciatic area, the pelvic area. Do you drink a lot of water?
Not as much as I should.
Okay.
But today I've had a lot.
Okay. So what was different today than the other days?
Well, I was helping, doing some work, some yard work.
Okay.
So when I was finished, I
Okay.
had at least two large bottles of water.
Okay. How is my pressure, Mr. King?
You know, good.
Reflexology helps with circulation. It helps with rejuvenation of the skin, stimulation as well too, overall wellness, health and wellness. Helps with stress, helps with fatigue. Just gonna open up the ribs and the chest area. And how is my pressure?
All right.
All right, meaning?
Good.
Okay. Do you want more, or this is just?
No, I think you're
Sorry?
It's good enough.
That's good enough, okay. So we're gonna do some finger plowing. I'm just gonna stretch, dorsiflex the feet a little bit. How is that?
Good.
Is it painful?
Mm-mm. Okay.
Gonna rotate it. I'm gonna do some traction. I'm gonna do some oscillation. I'm gonna effleurage. Okay, that completes the right feet. So now we're gonna go on to the left feet. Okay. The left feet, the difference between the left and the right, the left has the heart, the spleen, and the large intestine. Okay. Everyone looks forward to getting their feet massaged and rubbed. Who don't like their feet rubbed? Just doing some sea scooping. I'm doing some ringing. How is my pressure? Are you okay, Mr. King?
Yeah.
Yeah, how is my pressure?
Good.
Did I wake you?
Dreamland.
Okay, so I wouldn't talk to you now, so if there's any pain or too much pressure, just raise your hands up for me, okay? Some zones walking through the phalanges, taking the lactic acid out or edema. And then we're going to do some kneading, circular kneading around the ankle. So now I'm going to do exactly the same thing I did onto the right feet, where I start with the big toe. Some compression between the ears. Then I go to the pineal, which is just in the middle of the toe, or the back of the toe. It's the pineal area, so I just do a little bit of compression there. And then I swipe that out. And then this is the brains, which I just do some finger compression. And then I swipe that out. Then I do a little bit of wiggle. And then we're going to the second toe. Exactly what I did with the first one. Squeeze in the middle, which is the pineal area. So you just do it for a couple of seconds. So you use the tip of your finger, stabilize the toe, and you just do some compression. And then you fork it out, fold it and fork it out. Then you wiggle again, and anti-clockwise. Same thing we're gonna do for the third toe as well too. So I'm just squeezing that, waking up the tissues. Then I'm gonna go again, squeeze the pineal, just hold it for a little bit. And then you would use the tip of your finger, you stabilize the toe, the tip of your finger, and you just doing some compression. So you do it 3 times, and then you wiggle it, and you pull that out. Same things apply to the fourth toe. Usually these toes tend to get in the way, so you have to try to stabilize the toe that you're working on. Again, you squeeze. Okay, so then I'm gonna, Mr. King is gone to sleep because he's snoring on me. Yes, it does. It is relaxing, especially when you touch the tip of the toes. It is very, it's amazing how sensitive, you know. So I'm gonna again squeeze. The pinky toe sometimes can be very problematic in the sense that because it's small, just to get the angle, right? So for the brains again, 1, 2, 3. Then we move back again, forward, 1, 2, 3, then backward, 1, 2, 3. Every technique that you do, it always goes in 3 dimensions. So the we're going to be ringing again. So we're going to be doing, this is the anterior tibia, and this is the posterior tibia. So we're going to be doing some C-scooping. And then I'm going to be doing some kneading. So you just, 4 fingers, and you just do some circular kneading on both the anterior tibia and the posterior tibia. And then you spread it out, and then again you start again. As I mentioned earlier, everything is done in 3 dimensions. And then you bring it again right out. 1, 2. And then you squeeze, bring it right out. And then now you're going to be opening up the ribs area. Open it up. Again. Whilst you're crisscrossing the finger across the ribs. So then now we're going to go at the plantar of the feet, which is the bottom of the feet. So I'll work on the zones. So what I'm doing right now, I'm just doing some finger walking or finger compression. So we're going to be doing it right down. And then I slide up again. So we go under the second toe. or the second phalanges. Doing the same thing, so it's the finger walking, so you just pressuring. And you slide right up to the second toe back again. So we go into the third toe or the third phalanges. I should use the correct terminology. So and then we slide it right up. And then now we're going to the foot. So repeating the same thing. If you find that your thumb is hurting, you can use your knuckles. Right, just use your knuckles. And you slide it up. Again, knuckles again to the fifth. And then you slide. And then just start to do some finger rubbing against the spine. This is the spine area. And you rub it out. Just squeeze. Go to the knee. On the side here is actually the knee, which is over here. This is the knee. The knee area down here, because most people have a lot of tendonitis or pain associated arthritis in the knee, so you tend to do some circular, and then you do some pinching as well too. Just sort of massaging the Achilles tendon. Massaging the organs. I'm going to effleurage the feet. Then I'm going to do some stroking. So now I've completed the reflexology. The hot towel from the steam cabinet. And can you take this, Mr. King?
Ooh.
It's too hot?
Ooh. Well, it's hot.
It's hot? Okay. All right. What about this?
That's not too bad.
So you can take it?
Yeah, I think so.
Okay.
You see me jump up, you know.
So then, what this does basically, because I was aggravating the feet to the bottom of the feet, so the blood was all over. So what this will do now, just stabilize, and it's a good feeling as well too after the massage. So you just put a hot towel and you squeeze.
So good.
Yeah. And you squeeze. Just keep squeezing. And this also takes off the excess oil that's on the feet. So we just squeeze. Doing the stroking technique. So, Mr. King, this completes your session for the foot reflexology. What was my pressure like?
It was good.
It was good?
Yeah.
Okay, awesome. Well, I can tell that you did enjoy because you were snoring. Right. Remember when you were lying down, I was trying to explain to you in terms of the chart, the back or the plant or the bottom of your feet. You know, it's divided in 4 sections. So the heel part is the pelvic area and the sciatic, which is the lower back. You know, from the heel to here is the abdominal area. The above the abdominal is the thoracic area, which is the heart and the chest. And just above the thoracic area is the head. And where you see all the numbers, that's the brain. That's the brain, right? At the side here is the shoulders. Okay? Yeah, so that's why I like to show this diagram so people can have a visual in terms of what the bottom of their feet looks like and the organs that it reflects. Yeah.
Well, thank you. I hope you all enjoyed that demonstration that we had with Janice Gordon and Mr. Alpha King. I will go into a question and answer phase. However, I do want to highlight again that it's important to note that reflexology is not a cure-all, nor does it claim to be as such. Okay, so we have Alpha and Janice here. We do have also, we have 2 questions that came in from people who are actually attending the webinar as well with us. So I'll start with those questions and then I will go into my own questions as well. Janice Gordon is with us, but she's just not unmuted here. Again, today seems to be a technically challenging day. So one of the questions I have from one of our attendees on the webinar, the question was, is reflexology, sorry, would reflexology be beneficial for someone with a concussion? Anyone with any serious health challenges should consult with a physician first if you have any serious underlying conditions. So Janice she's having a little bit of connectivity issues. She has texted me some answers as I was feeding the questions to her. She says, basically, as I said, consult with your physician if you have any serious physical health challenges. We had another question from someone asking, are there any scientific papers or medical research done on reflexology? The answer is no, there are not many studies done, and the studies that have been done are quite weak, but it may have some value as a complementary therapy, such as getting a massage. There's no medicinal theory on getting massages, however, it could be complementary. Reflexology is non-invasive and it's comfortable to receive. However, again, to stress that if you are thinking about getting a reflexology massage, can always consult with your physician as with anything else. So hopefully that answers your questions as far as that goes. If there are any more questions, feel free to type it in the chat. And again, I will say, if anyone's asking any additional questions, we are not doctors. We are only information providers, and that is what we're doing. You can take the information. If it sounds like something you're interested in, go to your physician, and your physician will be the one who is better equipped to answer that question. With that being said, while Janice is still trying to connect with us, Alpha, how was it while you were receiving the foot massage?
Quite relaxing, I must say, because even, I don't know if you heard that Janice mentioned that she heard me snoring, so I don't know if...
I heard that. So I mean, I've gotten a massage before and it's put me to sleep. So you're saying that it was quite relaxing. Was there any particular part of it that was uncomfortable for you?
No, but I would say that those of you who have who are prone to being tickled or anything like that, then yeah, you might have some issues with someone messing around with your toes and and your feet as for that time. So unfortunately, but I didn't notice too much of that because, like I said, it was truly a relaxing treatment. You know, and I've had, actually, when I went in there, I went in with a slight limp from something that I had done earlier in the week.
Right.
And by the time, of course, by the time I was finished, I walked out normally as though, you know, like no limp, no pain was there, which was amazing. So, you know, it's great to see it in action and to actually had, I was glad that I actually did have something when I went in there to actually see, well, can this help? And
To gauge the
so
difference.
it was great.
Right. And again, I would say that individual results will vary depending on the level of discomfort you have. What we're discussing right now is Alpha's experience with this and the relief he felt after having this done to him. Janice, welcome, welcome, welcome.
Thank you. I'm
It's
having
okay.
challenges.
It's been one of those days. I had some challenges getting the video started as well, but we're glad that you're able to make it here onto the call with us. Uh, Again, I know you gave me some answers to those questions that was provided. And was there anything else you wanted to add to any of those questions? Anybody with serious medical conditions, should they get reflexology?
Well, you know, what it also does, it improves the function of the organs, systems, and glands through reflexive stimulations. So it will be the finger technique that we will be working on the plantar of your feet. Also, what it does, it helps with stimulation, optimal health, and it allows you to excrete the toxins from your body, and you will be yearning for more water because you'll be dehydrated. So you'll be consuming a lot more water. What else do I need to say?
Can you possibly share with us, you know, any, not without naming clients, obviously, other kind of challenges people have come in with and how it's helped them? Have you gotten any feedback or testimonies from people?
Yes, I have. I actually work on both a lot of seniors, you know, in terms of helping them with range of motion. You know, range of motion is a big thing with seniors in terms of as we age, our bones are depleted. So there are certain reflex points that you would work on the body at the bottom of your feet, you know, or the palm of your hands to
Right.
enable that increase of range of motion.
And that's something we should highlight as well. In this particular demo, we chose to focus on the feet. However, it can be used for other points of the body. And what are those other points as well, Janice?
Head, hand, feet, entire body, because you can
Okay.
also do the entire body, you know, with reflexology massage.
Okay. And I'm curious, one point, I'm not sure if I got the word right. You asked Alpha to do some diaphragmatic breathing, at which point you pressed into the base of his feet. What does that do? Well, Alpha, I'll come back to you after. How did that feel, if you remember? But Janice, what does that do for the person?
So that was the solar plexus that I was sort of applying pressure. And the diaphragmatic breathing is he inhale and then he hold it and then bring it out. And like, you know, with a strong puff. And what that does, it just open the airways, you know, so allow the oxygen to rejuvenate around the heart and the respiratory body, part of the body.
Okay. Yeah, and Alpha, do you remember that part when she did that with you? How it felt?
No,
Did
I
you
was
feel
sleeping.
anything?
Um,
He was he he was sleeping for much of it, so we're just gonna try and extract as
no,
much information as we can from
but
Alpha.
I do remember having the that feeling, and it was, you know, it was those that deep breathing again,
Mhm,
you know, filling my lungs with oxygen,
mhm.
and you know, and then relaxing and releasing, and it did feel. I think I felt a like almost like a coolness, and as it and more relaxation came into my sphere, and so that's probably why I ended up having a few dozing moments.
Being in a more relaxed state, exactly. So it definitely is very relaxing. And we all know our feet are like our roots of the tree, right? That's everything goes onto your feet. So your feet take on a lot of pressure, and I think oftentimes our feet are abused, and we take them for granted. So it's definitely a good relief just to someone who's on their feet all the time, right? You also mentioned, Janice, that the feet are the blueprint to the body, and you showed us a diagram at the end of the massage. Can you elaborate on this, and does it mean that we can diagnose or cure certain ailments by the corresponding foot region?
Yes, I would totally agree with that statement, and thanks. That's a very interesting statement question, Desiree. Our feet is the blueprint of our body. The bottom of our feet reflect the organs, the entire organs of our body. As you saw the segmental map that I showed you, which the heel part, which covers the pelvic area, then you have the abdomen, then you have the thoracic area, which is around the chest, the heart, the lungs, and then you have above by the tip of the toes, and that is the brains. So it's amazing, and just between the phalanges, that's the neck. The shoulders on the left, and the inner part, the medial part of the feet, that is the spine, the spinal area. So if we don't take it, one has to remember to, our feet carries our entire body weight. So if you don't take care of your feet, then you would not be enjoying optimal health. So the feet is very paramount in terms, it's just treat the feet like a car, because if you can't get point A, then you get frustrated. So that's why we have to treat the feet as though it's a motor vehicle, and we have to take care of it.
Right. Now, I also noted that when you switched over to the left foot, you mentioned that the heart, spleen, and large intestines were there. Do you treat the left foot different than the right foot? Because I was like, huh?
No, the techniques are similar, but it's just for more or less for information purposes, like you sharing. So you're letting the client know which part has the focal part on the heart, spleen, and the
but there's no difference. There's no difference in the treatment because it's the different zones that it covers between the feet.
No, the techniques are the same.
Okay. All right. Because that was definitely a question that popped up in my mind. I thought it was quite interesting. And how long is a typical treatment?
An hour.
An hour. Okay. Yeah, what you guys saw was the edited version of the entire treatment. So it is roughly about an hour. I have another question coming in from Leah Soar. How many treatments in a month do clients usually receive on average?
Well, it all depends on what insurance benefits that you have. There are some clients that will come twice a week, some come once a week. So it's all varies on your financial needs and the insurance that you have as well.
I agree with that answer because I'd like to get a massage every night. However, the average person probably gets one every 4 to 6 months, right? So it really comes down to what you choose to indulge, and I will use that loosely in for yourself. Janice, so are treatments, I guess you kind of touched on this, are treatments covered by OHIP or private benefits? How are they covered?
It's covered by private
benefits. Okay, and if not, on average, what is the price range if someone doesn't have benefits? What are they looking at per hour on average?
It's usually $90 an hour, but right now I've got a COVID special going on, and I'm charging $70 for the hour.
Okay. And Alpha, having never had a treatment before, again, you've mentioned some benefits. Would you do it again? And how soon do you think you'll be doing it again? This video was recorded about a week ago.
Yeah, it was wonderful, and if I could easily do it again, like you said, almost every night. But like you said, it's just one of those things that I think I will do it again in less than a 6-month period. I think my insurance does include it. So if I work it out, I can probably do it 4 times a year easily, and
Right.
you know, and just get that relaxation feeling. Just knowing that I need to have some more water, and again, not to have to get up and do anything after, like the next day or anything like that. I'd like like a weekend of just relaxation.
Yeah, yeah. Folks, really, it comes down to treating yourself how you should treating yourself well. I mean, let's look at it. We as women know, especially wearing heels, there's nothing like a good foot rub after a long day with your feet throbbing in those heels. So it's really an option. We're here to show you options. Reflexology is an option. Just like chiropractic treatment, it's an option. There are several options we can do that are non-medical that benefit us. So we're just giving you your options on ways if you have a older person who's complaining about their feet, speak to the doctor. As I said, number one, speak to the doctor. But also, if they say yes, then give it a try. It may or may not be for you. I mean, I've never been to a chiropractor before, and I went my first time about 3 years ago, and I swear by it now. Someone else may not. So it really comes down to options and exploring your options in a safe environment, in a safe manner. Right? Janice, do you have any other tips or pointers that you'd like to highlight for us?
Okay, taking care of your feet. Try to, even if you can't afford a reflexology, you can do some home treatment. Epsom salts, soaking your feet down in Epsom salt in hot water for 15 minutes and just flexing the toes like that. That also helps with excreting the toxins from your body. Consuming a lot of water helps tremendously. So it helps with the dehydration and its overall optimal health. Walking, walking bare feet, connect with earth. Connecting with earth is also very good because it helps with stimulation. Again, it helps with getting you reconnected. So
Yes.
yeah, that's what I will need to share with you at this point.
I love walking around bare feet. It just, like you said, it feels good just connecting as opposed to having, we all have different arches in our feet. So it just feels good to just connect barefooted. So I definitely can agree with that. I want everyone to remember that helping yourself, a spouse, or an aging parent to avoid falls goes a long way towards preserving health and independence. There is no one size fits all answer. It's all about exploring the options and finding the options that work for you. November, as we mentioned, is Fall Prevention Month. And for the entire month of November, the Senior Living 4-in-1 series will be speaking to several industry experts on things such as various aspects of fall prevention. Join us tomorrow, Sunday, November the 8th, when we discuss the 411 on indoor and outdoor stair lifts. Now, stair lifts help you master the 3 R's, which are regaining your independence, retaining full use of your home, and remaining in the home you love. Installing a stair lift turns your home into a bungalow by removing the obstacle of stairs if they become too challenging. I would like to thank you, Janice, for skeetzing in and making it in just in time to answer some questions on the interview. And Alpha as well. Thank you for your support. I look forward to seeing everyone tomorrow for the 411 on stair lifts. Have a wonderful, wonderful evening. Bye.
Thank you.